start to. And all you have to worry about is just getting the anatomical part. Okay, so we're going to be doing an injection into the capsule of the knee for viscosupplementation. I just want to show you the anatomy right here. There's kind of a soft spot right here, and just show the kneecap a little bit. Yep, the kneecap is right there, so we're just proximal to the knee. And there's a soft spot right here posterior to the iliotibial band, which is right, or the iliotibial band right down here, and the lateral head of the quad is right here, and right in between there's a nice little soft spot. So I previously marked that. And now if you look at the ultrasound, you can see there's the patella on the right, which is creating a shadow so that you can't see anything deep to the patella. And then lower left you can see the femur, which of course is blocking the signal, and then you see soft tissue going forward. Then there's a big black space, which is the synovial fluid, and then anterior or surface to that is the patellar tendon, which is that nice smooth upper left to kind of mid, upper right to mid left, that nice granular band right there. Now, you see when I push here, it kind of expands the synovial space a little bit. It kind of fills that, so we're definitely in the right spot. So what I'm going to do right now is just put, so sir, I'm going to give you a pinch right now with a little bit of local anesthetic. That always stings. Then I'm going to put local anesthetic in deeper on the track we're going to go. So Zyra, you can move to the short axis now. So now you'll see under ultrasound, now we're looking in cross section. So you see the femur down deep. You see a cross section of the patellar tendon, which is kind of difficult to describe, but you can imagine it. And then you can see as I push, the right side of the screen is where my entry point is, and you can kind of see the tissue deep moves and the tissue superficial doesn't really move much. So now I'm going to go deep with the injection. And usually it's pretty much all soft tissue that I'm going through. And this is a 27 gauge needle, and sometimes you can see it, sometimes not. So I'm a little bit superficial. So I'm going to pull back. You can see the needle there in the upper right. I'm going to pull back and just go a tiny bit deeper, put a little bit more local anesthetic in. Then you can see I'm right in the space there. And we're just kind of futzing with the ultrasound a little bit to get perfect view. Looks nice. Now I'm injecting through the 27 gauge needle, which is just local. So now I'm going to change my needle over to the 22 gauge. Usually with the 27 it's hard to actually pull back any synovial fluid because of the viscosity. So I'm trying to go down the exact same track. Let's see if I do that. Yep. There's the needle again. Now you can see it looks a little bit magnified from the 27. And now you can see in the syringe there's actually synovial fluid entering into the syringe. So that's even more positive sign that we're in the right spot. So this is really a nice picture. I really appreciate our patient volunteering to be videoed. And now I just switched the syringe to the visco supplement, 2 cc's with 1 cc of local anesthetic. And a lot of times you can kind of see a swirl in there. You could see a little bit of that. And then I'm going to pull the needle out. There we go. Okay, stop.